Hello, I'm Vivian from Malaysia. I'm here to share with you on one of the studies that we conducted in 2019 on exploring the health and environmental vulnerability of the smallholder farmers to slow onset climate event in tropical country Malaysia. And through this study, we found that is possible and positive to accelerate the resilient recovery by aligning the land to the human health. My background is environmental health, and my research niche focus on the interdisciplinary study of health in the rural environment and among the rural community, in particular the agricultural community. Malaysia is one of the high-risk countries for being affected by the slow onset climate event as a result of exponential population growth, industrialization, urbanization, which include the industrial agricultural setting. A recent survey by the ASEAN Studies Center found that Malaysia, Thailand, Indonesia has a relatively low concern and perception when it comes to the climate change. So why do Malaysia has a relatively low concern when it comes to climate change? Are we not at risk in any form? No, I don't think so. Storm and extreme events such as drought are increasing, peatland and forest fire become frequent, and the incident of transboundary haze is actually happening and increasing every year. Everyone in Malaysia is experiencing the effect in our day-to-day life, and especially among the lower income community and the rural community. So in view of this, climate change or any slow onset climate event is putting our rural farming community at a great risk while they risk their life to produce the food for us to put on our plate. Remember this. Once in your life, you need a doctor, you need a lawyer, or you might need a police. But every day, 3 times a day, you need a farmer. I need a farmer because those are the group of the people who put food on our plate. So how does this slow onset climate event affecting them? From this study, exploring the health and environmental vulnerability of the smallholder farmers to slow onset climate event in the tropical country Malaysia, we found that number one, the rural and industrial farmers bear the increased physiological health risk burden as compared to the rural agroecological farmers who work under the same extreme climate condition. Number two, the soil health of the industrial farmland has greatly affected under the slow onset climate event as compared to the soil health of the agroecological farmland. And number three, the agroecological farmers are much more adaptive than the industrial farmers when it comes to the climate change adaptations. And these are some of the journals we publish or in a peer reviewing process by the Citation Index Journal. Do feel free to read them. And this infographic was drawn from the work of the Ecology Watergate, which is an example to describe the differences of two basic approaches to agricultural development via the lens of planetary health. On your left is the industrial agriculture, which is widely occurs today, which was left with the environmental degradation problems, farmers' health concern, food security issue, and was impacted greatly by the climate change. The other is what happened when we committed to planetary health and human sustainability. One worked against the natural ecological forces, another intended to work together with the ecological system. And thus, our work highlights that agricultural health and soil health challenges in the tropical country Malaysia, and will propose a pathway for implementing a sustainable planetary health approach in the agricultural setting. Despite the fact that this work is based on the Malaysian scenario, it is applicable to any developing country context. In fact, the current and the biggest challenge of the sustainable agriculture system today is our ability to overcome the siloed approach that we have been experiencing so far. If we want to ensure that the planet maintains its ability to support us, we must include everyone on the table. Sustainable food and farming systems should not only rely on the farmer alone. It should involve the multidisciplinary, transdisciplinary team that ranges from health, ecological, environment, agriculture, even to the climate science, which will ultimately lead us to safeguard our planet and its health. Remember, farmers are at the center of each of the many challenges that we face, and they are the solution for each of the challenges that we face today. My research interest is in agriculture, rural health, and my passion to safeguard the health and livelihood of the rural community. For the sake of the sustainable agriculture and resilient recovery of our farmers' health and also environmental health, let's connect for future collaboration. Thank you.